That was a really interesting discussion, Dr. Hong. Can you tell me any kind of any final thoughts that you might have, like as overall to tie it all together, thinking of where do you think, where did this field start? Where has it grown? Because you've seen the growth of this field from an infancy now to, I mean, kind of like a maybe not a teenager, but maybe in the early 20s, right? So I think you've seen this thing. So where do you think this is starting, and where do you think we're going?
Yeah, it's an incredibly exciting time in oncology. I mean, I think all of us see these announcements from ASCO and from the FDA of new approvals almost every day, and it is kind of challenging, I think, to keep track of all of this. There will be additional changes that emerge in the next several years, in the next decade or so. But I think it's important to keep in light of all of this. I think that we will see, as we talked about tumor agnostic therapies, I think we will see more indications in the future. So it behooves the community oncologists, it behooves the oncologists to understand this testing, which vendors can actually
provide all the testing and everything, right?
Testing, and that's incredibly important. And so I think that we will see a lot more changes in the next decade. And so keeping up with all of these changes is incredible, not only just for obviously your education, but for our patients.
For our patients, because I think this is just the tip of the iceberg, right? More testing is going to be done, more targets are going to be found. Even in those targets, if we can treat them with the current agents, they can get a resistance, so we kind of biopsy those tumors again, find if there's resistant mutation, try to see if we can target them again. So it's kind of like this whole field which is going to grow. But it's important to see that there are some approvals for the patients in this tumor agnostic approach.
Yes.
Thank you, Dr. Hong, for this insightful discussion. And thank you to our audience for watching this targeted oncology presentation on precision medicine.